Stat-A-Dyne wrist hand finger orthosis, clinical advantages is that it's a two-joint product, so it allows us to address the extrinsic musculature. The other advantage of being a two-joint product is that we can eliminate the extrinsics and we can isolate the capsule on the wrist more advantageously. Starting distally, you'll notice that the device looks very similar to the Vector 1 hand CPM. We did that on purpose because of the clinical advantages that the Vector 1 hand CPM offers. For example, if we have somebody who can tolerate more motion on a certain finger, we can actually flatten the arc in the malleable spring to lower a digit. As the hand equalizes in its range of motion, as the patient improves, we can rebend that wire and equalize those digits. In addition, if we have a plate or a screw in one of the joints of the fingers, for example, if we have a plate or screw in the long finger or digit 3 at the distal phalanx through that last joint, we can actually move the finger plate to the middle phalanx, which allows us to still address MP and PIP motion while at the same time neglecting the distal interphalangeal joint. The advantage of having the Stat-A-Dyne wrist hand finger orthosis digit knob is that the device can afford a full composite fist as well as hyperextension. So I will bring the device into a full composite fist so you can appreciate that. But I can also address wrist range of motion. So if I bring my wrist into flexion with my digits that are in flexion, we call this combined motion therapy. If I do combined motion therapy of the wrist and the digits in flexion, I'm actually stretching my long extrinsic extensor musculature. That position is advantageous for people like dental hygienists, also for mechanics who need to flex their wrist and their fingers when doing dental work or when they're working on an engine block. If we do combined motion therapy of digit and wrist extension, then I will actually address the long extrinsic flexor musculature. So now I'm stretching my long extrinsic flexor musculature. This comes in well for somebody who needs to pass a push-up test, perhaps like a police officer or firefighter, or for a waiter or waitress who needs to carry a tray in after a distal radius fracture. Functionally, this obviously allows us to open doorknobs when going in and out of different rooms, wrist and digit extension. If we incorporate the theory of tenodesis and we keep the fingers in hyperextension and bring the wrist in flexion, the advantage of this position is that we've now taken the long extrinsic extensor musculature out of the equation. So if you visualize this glove as my long extrinsic extensor musculature, you'll see how the glove has slack in it, which allows us to address the dorsal wrist capsule more advantageously. This will isolate the stretch here on this capsule by eliminating the long extrinsic extensor musculature. Once again, if we examine the principles of tenodesis and we put the fingers in full flexion, but bring the wrist in extension, we have now eliminated the long extrinsic flexor musculature, which allows isolation of the volar wrist capsule. So I will stretch my volar wrist capsule more advantageously here by taking the long extrinsic flexors out of the equation. Now we're going to speak about the Stat-A-Dyne elbow contracture management device. The first thing I would like to touch on is the ability of the device to go into 45 degrees of hyperextension. The reason why we've chosen to do this is because if we have a lot of proximal soft tissue give at the bicep and the tricep, what happens with a lot of range of motion braces in the marketplace is the brace will actually say on the range of motion numbers that the elbow's in 10 degrees of hyperextension, but the elbow itself is actually in 10 degrees of flexion. So you can overcome soft tissue give by having a device that goes well into hyperextension. The second thing we addressed by speaking to certified hand therapists and our fellowship-trained hand surgeons is there is no other brace in the marketplace that allows you to adjust the carry angle when addressing a contracture. So the Stat-A-Dyne elbow product is the only contracture management product in the marketplace currently where we can adjust the carry angle with these 4 bolts here on the distal cuff as well as these 4 bolts here on the proximal cuff. Now, the beauty of that is you can have a very comfortable brace in flexion and extension, but if that cuff is actually tweaking the arm into a medial plane or into a lateral plane, you're still going to have medial or lateral pressure areas, and you can overcome that by adjusting your carry angle. You can also make sure you don't violate a precaution or contraindication with a medial collateral or lateral collateral repair when you adjust the carry angle. Thirdly, I would also like to touch just briefly on our L-shaped bracket. The L-shaped bracket offers tremendous advantages to eliminate pressure areas because we can allow our cuffs to stay more uniform on the soft tissue. So I'll give you an example here. Let's say we have somebody who has a 20-degree elbow flexion contracture and we're working to get that elbow to 0. Well, it's common that the patient will have a pressure area on a cuff somewhere from 20 to 0 because the cuff doesn't stay lined up uniformly with their soft tissue. The reason why that happens on competitors' products is a lot of competitors will mount their cuff to the actual strut of the device. Our cuff is mounted to this L-shaped bracket, and what that allows us to do is if we run into a pressure area, we can simply loosen these wing nuts and then we can adjust the L-shaped bracket in any fashion to make sure our soft tissue distribution area stays more uniform from a pressure standpoint. Moving on to the elbow flexion features of the device, what we're going to discuss now is the ability of the device to truly achieve 140 degrees of elbow flexion. What happens in the marketplace with some other products is when we get around 90 degrees of flexion, 2 things typically happen. We either have a soft tissue pinch between the 2 cuffs, or we run into literally a mechanical barrier between the 2 cuffs, where this cuff, the distal cuff, will actually hit the proximal cuff and will not allow any more elbow flexion. We've overcome that simply by this adjustment here. Our distal cuff opening is on the medial side of the cuff. We did that intentionally so the top of the cuff would push my arm into extension well, and the bottom of the cuff would push my arm into flexion well. However, on the proximal humeral cuff, we've created the opening or entry point to that cuff on the anterior side. And what that affords us is on elbow flexion, we can open that cuff, we can educate the patient to move their D-rings, and then the distal cuff will actually fit inside the proximal cuff, allowing terminal elbow flexion. This is a Stat-A-Dyne hinge, so if we have somebody who is having some ulnar nerve symptoms, we can simply choose dynamic and we can educate the patient that they can push out against the dynamic spring, allow that ulnar nerve to get some blood supply, and then they can relax and go back into dynamic flexion. Or if they choose, they could use static progressive splint therapy by day and dynamic low load prolonged stretch by night. When examining the Stat-A-Dyne supinator pronator, we once again address the issue of proximal soft tissue give. If we have a patient who has proximal soft tissue give on the bicep and the tricep, what was happening with other devices in the industry is even if the device went to 110 degrees of supination, the actual extremity was only at, let's say, 75 degrees of supination. You overcome that by having a device that actually has infinite range of motion. So the Stat-A-Dyne supinator pronator allows the supination pronation component of the product to go into infinite range of motion. So no matter how much proximal soft tissue give we have on the bicep and the tricep, we can truly achieve 90 degrees of rotation both in supination and in pronation of the distal forearm. Stat-A-Dyne hinge allows both static progressive type therapy, or if you have a patient who is complaining about forearm numbness, we can choose the dynamic mode, and the patient can actually reach over with their non-involved extremity. They can push through the dynamic tension of the device, allow that interosseous membrane to get blood flow, and then when they relax, it's going to bring their extremity back into a supinated position dynamically, into pronation or supination, depending on what you're addressing. Once you offer infinite range of motion on a therapy device for supination pronation, the next concern is eliminating what we call carpal torsion. So our certified hand therapists mentioned that they wanted a distal cuff that controlled rotation of the forearm very well and eliminated carpal torsion. Our fellowship trained orthopedic hand surgeons spoke to us and said, we want a distal cuff on the product that actually causes rotation of the radial head as it should appropriately at the proximal joint. So in both pronation and in supination, this 3/4 cuff captures the soft tissue well, both longitudinally and circumferentially. The other advantage of this cuff is that donning and doffing the device is much easier because the cuff is not bivalved. So the patient essentially karate chops, if you will, down into the cuff and simply tightens these two straps, and it captures the soft tissue very efficiently. If you look at our anatomical range of motion numbers on the device, you'll notice that from 0 to 90, the numbers are in black. One of the protective features we've offered on the brace is when the patient starts getting beyond 90 degrees of supination or pronation, from 100 to 130 degrees, the numbers turn red to identify to the patient that they're starting to get outside of anatomical norms. An additional protective feature on the supinator pronator device that you can incorporate for a patient that you may be concerned about going beyond what is appropriate for them in therapy is placing a zip tie underneath the supination pronation strut onto the actual frame of the device. As you can see, when I go into supination, the zip tie becomes taut and does not allow the device to go any further than 90 degrees of supination.